Hello, and welcome to our first edition of Let's Talk About It. I'm Margie Urban. I'm a physician from the University of Rochester in the Infectious Diseases Division, and I am here with Let's Talk About It that's sponsored by the New York State Department of Health Clinical Education Initiative. We at the CEI are charged with providing education and training and support for providers across New York State about a variety of conditions like STDs, HIV, Hep C, PrEP, PEP, LGBT health, and substance user health. Today is April 10th, as you know, and it's the 10th day of National STD Awareness Month. So we're going to talk about today a very important STD, syphilis. I'm not sure who all is out there in Facebook Live land. We think there's probably some providers and probably some lay people interested in syphilis. So I thought I would run through maybe 10 things that are important to know about syphilis today. So let's start with number one, the numbers. Since we're talking about this, I'm sure you can guess, the numbers are going up. We actually in the US had 10 or actually 11 years of rates that lowered from 1990 into 2000, and then they started going up in 2001 and have gone up every year since. The CDC says that there were approximately 89,000 new cases of syphilis in 2016. So numbers are going up, and it's important to think about syphilis. Number two, who's getting it? Well, it's not universally distributed, so this rise in cases since the year 2001 has largely occurred in men, and most have been among men who have sex with other men or who have sex with both men and women. In CDC's statistics, most recent statistics, it was approximately 80% of cases were in men. Number three, it's not all just syphilis. Lots of STDs are rising. Syphilis is one of the most important, and this particular trend that's occurred in the last 10 years has had the feature where almost half of new cases of syphilis in men, almost half of those patients already have HIV infection. So in that sexual encounter where syphilis is passed, there's a high probability or possibility of HIV also being passed. Number four, it's not just men who have sex with men, but in the last couple of years, the number of cases and case rates have been rising in women as well. The numbers are still much, much lower than the cases in men, but whenever you have syphilis in women, you have to start thinking about syphilis in babies as well. That's known as congenital syphilis, and when it happens, it can be very, very serious. The babies are affected in utero and may have really serious birth defects or even die from the syphilis. And congenital syphilis has gone up along with cases of syphilis in women. Number five, well, this is a little more complex. Let's talk about the disease itself. Syphilis is a complicated infection, and whether you're a clinician or a patient, from both sides, it's pretty complicated. For those of you in the medical field out there, you probably remember the phrases from your training. To know syphilis is to know medicine. Syphilis is the great imitator. And all of that is still true, even in the new millennium. So I just wanted to run through what the condition looks like. It's an infectious disease. It's caused by an organism known as Treponema pallidum. And you're exposed generally through a sexual encounter or a very close physical encounter. The organism enters the body, and if you had sex with somebody with contagious syphilis on the first day of STD Awareness Month, April 1st, you could go a full 90 days before you have any sort of findings of syphilis. So it has a pretty long incubation period. You'd go through April, May, and June before you might have the physical findings or even positive blood tests for syphilis. That incubation is usually 21 days, but can be out to 3 months. The first manifestation that happens then is known as primary syphilis, and all the medical providers, I'm sure, remember from medical school or nursing school the syphilitic chancre. That's the part of the lesion, the sore that's formed where the organism first enters the body, It's typically a round ulcer or sore, and it has the feature that it doesn't hurt. Because it's acquired through sex, it's often in places that are hard to see, and since it doesn't hurt and it gets better all by itself, goes away, usually or often the person who has this syphilitic chancre doesn't even know it. Once that happens and it heals without scarring, the bacteria spreads through the body, maybe all the way through both blood and lymph, and it can go pretty much anywhere. And that's where you get the great imitator saying. And once it spreads everywhere, you can get all sorts of physical findings. They mostly have the feature that they go away on their own as well. So if you mistake them for something else, you as the patient or you as the provider, you might have missed secondary syphilis. The thing that we think of most often is dermatitis, inflammation of the skin, or rash. Even that can look many, many different ways. You can have flat, bumpy, scaling, itchy rashes. They can be only in the genital area, only on the hands and feet, on the trunk, sometimes on the rash, on the face. And they last generally a few weeks, sometimes longer than a few weeks. Beyond just rash, though, you might have swollen glands. You might have hepatitis or inflammation of the liver. You might have inflammation of the brain, of the eye. You might just have a flu-like illness. All of those things may be going away on their own, and so again, you would miss it if you don't think about syphilis. After that, the condition goes into a period of latency. Latency means it's lying dormant. It's not gone, but not causing any physical problems. You would have a positive test at that point. And then finally, some people will go on after long periods of latency, usually many years, and have the last stage of syphilis, known as the late complications of syphilis, or tertiary syphilis. And this is what we think of that's portrayed in the movies or in books about syphilis in the 1500s, 1600s. You might have dementia or difficulty walking or trouble with major blood vessels or the heart. You might have strokes, so pretty serious consequences. This is rare in the present day, but not zero. So if you have untreated syphilis, this is still a risk. Number 6, how do you diagnose it? What is the testing? Well, that's sometimes complicated as well. There are blood tests that measure the immune response for syphilis, and even that is complicated. There's a couple different kinds of tests that have to be done for every patient. There's now lots of manufacturers and different tests that, if you're not seeing a lot of this, you as a clinician might not be familiar with. So the important thing to know is that largely the diagnosis of syphilis involves blood tests. If you're a patient and you want an STD check and you go somewhere and you only get a urine test, you probably weren't tested for syphilis, so you might need to ask specifically for that. Number 7, treatment. This is probably the simplest thing about syphilis. We had our first really effective treatment for syphilis that was developed in the 1940s. That was penicillin. It's given as a shot in almost all cases, sometimes multiple shots, but usually an injection into the bottom. Occasionally, if you've got some complicated condition, you might need IV syphilis. Even this can be given at home. IV penicillin for syphilis. It's given for 14 days, and that can be done at home. It doesn't have to be in the hospital. There is an alternate drug if you're allergic. That's known as doxycycline, and it's a pill. You might take it for 2 weeks or 4 weeks. There are some situations where you can never use the alternate, such as pregnancy, so then you would really need to use penicillin. Number 8, partners. Syphilis is a contagious disease. It's contagious generally in the first year of infection, particularly with that sore or some of the lesions you can get during secondary syphilis. So your sexual partners would need to be examined and tested and potentially get post-exposure prophylaxis if you've been exposed very recently before in that incubation period. Number 9, what about finding syphilis? How can we be good, keep ourselves safe? One is to use condoms, as with most sexually transmitted infections. Condoms can help protect. It's not universal, but it does lower your risk. One is having tested partners that are negative and being monogamous. And another is being sure that you're getting close medical care and being tested regularly if you're at high risk. It's important for providers to be sure that you ask about a sexual history and that you listen to your patients. It's important for the patients who might need testing to be sure that they're open with their providers and expect to be asked about this. And finally, number 10, how can we help? We at the CEI, we provide training about this all around the state, and we have a lot of resources on the web available for those in-state and out-of-state. That's at ceitraining.org. And also your local and state health department throughout the United States stands ready to help with the management of syphilis. They are available to help with treatment, with notifying partners in a confidential manner, and you can use them as a resource no matter where you're located. So I'll end there. I'm happy to take any questions, and if we don't have questions, please join us for the next Let's Talk About It, which will happen in May, and the subject will be HIV testing. Thanks very much.